A handful of states with relatively high vaccination rates are being overwhelmed with a surge of COVID-19 cases. In Minnesota, where 69% of residents have received at least one vaccine dose, more than 45,000 people are in the hospital. Nearly 9,000 are in the ICU. And in some places, doctors say they cannot take any more patients at all. Caroline Cummings is a reporter for our CBS station, WCCO in Minneapolis, and joins us now for more. Hi, Caroline. So what are officials saying is behind this latest surge of COVID in Minnesota?
Well, the doctors and nurses that I've been talking to, as well as the public health commissioner, are clear that the amount of COVID patients in the hospital are almost all of them unvaccinated individuals. And it comes at a time where we have the vaccine and we have people in the hospital unvaccinated, but the hospitals are being overrun, not just because of COVID patients. It's because there's fewer staff to care for these people who need acute care. And there's also an influx of really sick patients who need help that aren't sick with COVID. So the two together are creating this crisis that we're seeing in our hospitals today.
And so what impact is all of this having on patients who are not only being treated for COVID, but those who are requiring non-virus related hospital care?
Well, hospitals are really clear that the situation is dire. Yesterday, the two federal medical teams from the U.S. Department of Defense dispatched to Minnesota. They touched down at a hospital in Minneapolis, Hennepin County Medical Center, the largest trauma center in the state, and St. Cloud Hospital, which is in greater Minnesota and treats a lot of rural patients. And what they're doing is helping to relieve doctors and nurses and these hospitals that are overrun. And in Hennepin County Medical Center's case, they're the largest trauma center in the state of Minnesota. So they get a lot of transfers of people who, you got in a serious car accident, maybe in rural Minnesota, but you need the special expertise of the HCMC providers in Minneapolis. Well, they're at a point right now where there's on any given day, 20 people in the emergency room waiting to get upstairs. This is according to the CEO of Hennepin Healthcare, who spoke to reporters yesterday. And she said something that I think is illustrative of the greater crisis, is that this is an organization. Hospitals are in a profession where they're used to always saying yes and caring for people who need it. But now they're in a position where they've had to, and at least in Hennepin Healthcare's case, say no 400 times because they just can't deal with it. So these teams, the idea is that they'll expand the admitting unit for emergency care, expand some step-down beds for ICUs to open up more of that, to give the capacity, relieve some of that capacity issue to care for more people who are sick.
And so how are the local and federal governments stepping in to help alleviate this issue? Because clearly, this is a dire situation.
So the two federal teams I just mentioned are a key part of this. The one in Minneapolis at Hennepin County Medical Center is largely made up of service members in the U.S. Air Force. They're doctors, nurses, respiratory therapists, a team of 23. And it might seem like not a lot, 23 people, but the hospitals say it will be huge in terms of expanding capacity, because right now they have equipment, they have beds, but it's a matter of the staff to tend to those beds. And there's fewer healthcare workers on the job in Minnesota today than there were last year. That's according to the state's health department. So all of these factors together are creating a very untenable situation. So the idea is that these federal teams will come to those two hospitals, offer the staffing relief that they desperately need. But in addition to that, Governor Tim Walz is activating the Minnesota National Guard and having them trained, 400 of them trained to be certified nursing assistants. And those individuals, once they're trained, will dispatch to the state's skilled nursing facilities across the state and help with the staffing shortages there. These nursing homes are often places where people go for their continued care after they've been in the hospital. But as we've reported previously, there had been an issue where people were staying in the hospital for too long because there was nowhere else for them to go because long-term care facilities couldn't admit any more people. So between the Minnesota National Guard and these federal teams, the idea from the state is that these two together will be a short-term solution, and that is key. It's short-term, and they're really pleading with Minnesotans to continue to take proper precautions, and for those who are unvaccinated to get their shots, and those who have rolled up their sleeves to get those boosters now that they're available to everybody.
And what other steps has the governor given any indication he may be considering taking? Any new mandates or restrictions in response to this surge in cases?
So as of right now, it's clear that calling another state of emergency, which in turn grants the governor a whole onslaught of emergency powers he wouldn't otherwise have, that's off the table for him. And his reasoning is that he says that the tools to fight the pandemic are different today. We have vaccines last year where we were at around this time facing a similar surge. We didn't have those. And now we have that, which is obviously the best tool to fight the pandemic. But also he's cited the potential political fallout of doing so. Those powers would only be in place for 30 days. He would have to go to the divided legislature and request that those get extended. The Republicans have been sharply critical of what they believe is an overreach of those powers over the last year and a half before they expired this summer. So he doesn't want to jeopardize the fate of his health commissioner overseeing this pandemic from the state health department's perspective. The Senate Republicans have threatened to potentially not confirm her. They have the power to confirm top posts in state government under a governor's administration. So those are kind of the factors at play: vaccines, but also this potential to disrupt how the operations are at the state health department.
Well, getting back to those vaccines, I mean, you say that this crush of patients are largely unvaccinated, but Minnesota has a pretty good vaccination rate. So how do you sort of reconcile those two things?
Well, it's a good question. And previously doctors have just spoke of, Delta being in the summer when we kind of saw the uptick. It's a powerful variant that is impacting how sick patients are becoming. And so I think that that's a part of it from what the experts have said. But really, when it comes to the hospital issue, it's not just COVID. It's really COVID plus other people who need, serious care, perhaps care that they have put off during the pandemic. So those two factors together are creating kind of this very difficult situation for hospitals as they treat COVID patients. And there are fewer COVID patients in the hospital today than there were, like I said, this time last year. But it's really that confluence of people who have COVID and those who are sick with other illnesses that are kind of festering this problem.
All right. Well, Caroline Cummings from our affiliate in Minneapolis, thank you so much. We appreciate you being with us.
Thank you.